Yeah, but the very poor do get Medicaid.
Yes, yes, and one of the things about the Obama plan that I do like is that it expands Medicaid up to 133% of the federal poverty level, and that's fine. The problem is that that could have been a standalone measure. You didn't need to have it incorporated in this massive Rube Goldberg apparatus.
Is there anything else in there you like in the Obama plan?
Oh, yeah. I mean,
Why?
First of all, the intention is very good. The expansion of Medicaid is very good. Raising the age of dependents to 26 and saying that they have to be covered on their parents' plans, I think that's very good. Looking at the cost effectiveness of various procedures is a good thing to do as an end in its own right. So yes, there are things in it. But the bill as a whole, the more I look at it, the worse it gets. It's going to increase costs, not decrease them, and it's going to increase the rate of growth. It's not going to bend the curve, except in Medicare. I think in order to look at a reform and to measure a reform, you have to look at the problem it's designed to answer. You have to look at what's wrong with our system in order to evaluate a reform. You have to ask yourself, why is it that we spend over twice as much per person on health care and yet don't manage to cover everyone?
Why is that?
And the reason is that we have chosen, alone among all advanced countries, to leave health care to for-profit industries, to leave health care to businesses that then distribute health care as a market commodity according to the ability to pay and not according to medical need. So if you look at what's causing the problem, the causes are not being targeted in this plan. They're not being addressed. Maybe some of the symptoms of the causes are being addressed, like let's stop the excluding people for pre-existing conditions, but it doesn't stop the insurance industry from raising its premiums.
So how can you be sure, just as you say, politics often goes off track, we don't get the politics or the policy we want, how can you be sure that these terrible things are going to happen?
Well, if you get I think it was Senator Rockefeller who said, I mean, that was a wonderful comment he made in the summit last week. Senator Rockefeller referred to the private insurance companies as rapacious, and said, like sharks, they swim under the water and you don't know they're there until you feel their teeth. Now, there are not many people in America who would disagree with that description. And so what this plan does is says, this is a terrible industry, so let's force people to buy their commercial products and let's subsidize it and put a lot of money into it. Now, what do you think they're going to do? If you were an insurance company, you would say, well, thank you, Santa Claus. I've got all of these captive customers. Young ones are healthy. They probably won't even use the insurance. There's nothing to stop me from raising my premiums. I have all of these subsidies coming in. Don't you think that that the prices would go up? I think it would be remarkable if they didn't. When I look at the Senate bill and the President's suggestions, almost every paragraph, there is a poison pill for someone. I think sometimes they're unintended. Let me give you one example. They allow for insurance companies to charge 3 times as much for older people as for younger people. So from the point of view of the insurance industry, this is a godsend, because either way they win. Either the 55-year-olds cough up 3 times the premiums, and that's good, or else they can't, and that's probably the more likely situation. They can't, and then they're fined. And the insurance companies don't have to take care of people who might actually get sick. They're left with all of the 30-year-olds who are less likely to get sick, but who are required to buy their products. So this sets up a situation which probably all plans for 55-year-olds are high-priced, so they can't afford to buy it, or if they do buy it, they have to pay an excise tax on it. This is a real poison pill for these older people. It's a gift for the insurance industry.
But the president is pushing ahead. He wants Congress to act in the next month. What would you have us do?
I think the problem is this, Bill. If this plan is passed, and I think there's some real doubt as to whether it will be, and there's even more doubt as to whether it would ever be fully implemented. But let's say that it's passed. It will begin to unravel almost immediately. And then what will people do? Well, they'll say, we tried health reform and it didn't work. Better not try that anymore. It'll be like what happened after the Clinton plan failed. There'll be another 16 years before anybody comes up with the courage to try that again. People say, too expensive, just can't have universal care. Tried that, didn't work, goodbye. Whereas if the bill dies now, people can say, this bill died because it was a bad bill. And the problem is still on the front burner. And then one can hope that we get some version of Medicare for all, and that we don't have to wait 16 years.
What makes you think it would come back in 16 years or more? What makes you think it would ever be back on the table?
Oh, I think it has to be. I mean, I think that this system is unraveling so fast, doing nothing or doing the Obama plan so fast, that something will have to be done, unless we want to, explicitly be a third world country. So I don't think it's going to wait. But if we pass this plan, it's going to delay.
Are there any, 3 or 4 things that could be changed in the next month that would make you change your mind and vote for this if you were in the Senate?
No, I don't think so.
Not one?
That
if they took out the mandate?
That realistically could.
Yeah, realistic.
No. If you take out the mandate, then the private insurance industry says, no, we're out of here. And this Congress will do what the private insurance industry wants it to do. If you look at the money that has flowed into Congress over the last year, and particularly to people who were crafting this bill, you can see that the paymasters get what they want.
Marcia Angell, thank you very much for returning to the Journal.
Well, thank you.